So I'm very happy now to be joined by a good friend and an outstanding cardiac surgeon, Dr. Vinay Badhwar from Pittsburgh. Vinay, good to see you.
Thank you very much.
So, you know, I've been here listening to this, and for 2 days it's been fabulous. And we're talking about mitral valve repair. Is mitral valve repair, and I know you have an interest in this, you've actually published in this, is it applicable across all ages, older age populations?
I think this has been a fabulous meeting. All the world's leaders in mitral valve surgery are here, and it's just a great organized meeting. I think one of the issues that we're talking about is taking themes that are applicable to younger patients and applying it across all populations. One of the things that has recently been coming to evidence is that in the national guidelines that we have, both in cardiology and cardiac surgery, that are talking about indications, it's really, we're operating more and more asymptomatic patients earlier in the disease process because we can repair the valves. There's been some concern that maybe we can't repair or it's too late to repair in elderly patients. So we looked at our national database, over 5 million patients in this database, over the course of 20 years. And to our surprise is that patients that are in the octogenarian age range, you know, people that are elderly.
Yeah, I'm glad you didn't say in my age range.
I said octogenarian, buddy.
Thank you. You're still young. Okay, in the elderly range.
That I think the issues of just watchful waiting perhaps is not necessary, because we found in looking at these populations that actually they did just as well with repair as did younger populations. In younger populations, we know with mitral repair, their long-term survival returns back to the age-adjusted normals by the population, and that's exactly what we found in the elderly patients. So I think now we can start broadening our applications of these wonderful techniques to all of our patients, regardless of age.
It's interesting to me because you would think that if somebody has a disease process going on, and the longer it persists, the more the valve would change, the more the ventricle would change, those sort of things, but you found outcomes were just as good.
Yeah, I think that if we can repair the valve, and this is an isolated mitral valve repair, that the adjustment back to the normal populations, I think, is key. It changes how we think, because in the past, if we have an elderly patient, just put a replacement and let them be on their merry way. But in fact, I think the outcome is probably less well. And that these types of techniques that are becoming more and more commonplace, and as we learn more about the pathoanatomic reconstruction, in other words, form and function, if we can restore that, it doesn't matter how old you are. I think we can apply that to every age.
I mean, it's a valid point, because I hear that all the time from colleagues. This person's too old, let's just do this. So, Vinay, let me ask you, because you've been very, very active in this area, what do you think are some important areas for future research in mitral valve surgery, mitral valve repair?
So, you know, we've heard lots of technical issues on this meeting, and lots of tips and tricks, and some of the progressive research areas. One of the things that we need to really analyze is which techniques apply to which subpopulations and what are their long-term outcomes. Our national society, the Society of Thoracic Surgeons, one of their societies, has a very robust database. And that database is now evolving to then do a sub-analysis through the latest version of that database to actually have very specific markers of the type of chords we use, the type of technique, a lot more detail specifically to mitral valve in this modular format. We now have 1-year data accumulated, and we're now analyzing that data, and it's telling us some very interesting findings, which will come to the literature, I think, we hope, in the very near future, about outcomes of certain specific subtype techniques. I think some of the future research will be not only outcome basis by technique driven, but subpopulation driven. Which is the best patient to get, which technique, at what age, and then linking those databases, our national database, to healthcare claims-based databases such as the Center for Medicaid and Medicare Services. And that is, I think, the next phase of outcome-based research. So
you're basing it on both techniques, technology, outcomes, and then cost effectiveness to some extent?
Precisely.
Okay, that's fabulous. Do you saying that then, and we'll end up with this, does that mean that there are going to be different repair techniques for different etiologies? I mean, we already have that to some extent, but I mean, are you going to really be able to stratify it? So if you have condition X, you probably ought to do this.
Yeah, I think a lot of it has to do with the reproducibility and the long-term durability of any said technique. I mean, one thing about, us as humans, we're very creative individuals, and surgeons, hopefully, more so than most. And this meeting is just one such great gathering of very creative ideas and thoughts of how to solve this problem. And I think what we have to discern is how far do we go, and to whom do we apply that to? I think through some of this, we'll try to get those answers and maybe simplify the approach to very certain populations to get the best long-term outcome and avoid reoperations. And I think that's where the data will tell.
Absolutely, and by doing that, then you're helping the patient ultimately and helping society with that. Vinay, fabulous stuff. Good to see you, my friend. Thank you. Take care.